name is Amber Likens, and
Hello.
this is my health assessment video.
How are you doing?
Good. Can you state your name for me, please?
Chad Likens,
And what is your age?
36.
Okay. Can you tell me the date today?
The 6th of October.
Perfect. And what building are we in right now?
We are in my home.
Do you know what your height and weight is?
5'6", 200 pounds.
Okay. So I'm going to be doing a head-to-toe assessment on you. Do I have your permission to do that?
Yes.
All right. First off, I'm going to just take your blood pressure real quick. And you're just going to put that right up to your heart. Try not to flex too much with that. This is going to tell me your oxygen saturation as well as your pulse. But while that's going, I'm going to go ahead and look at this clock and count your radial pulse for about 30 seconds. Hold on. Let's turn that some. There, that should be more comfortable for you. Perfect. Alright, so I'm going to count that radial pulse for 30 seconds, then multiply by 2. Alright, I have a heart rate of 80. While he's not looking, I'm watching his respirations. I do see that they're unlabored and even. I'm just going to count his respirations over 30 seconds as well. Respirations are 16. Your oxygen saturation is 98%. Your pulse is 76 on this. Let's check your blood pressure. 138/87, so just a little elevated. Do you have any pain today?
No.
Any complaints?
Nope.
Alright. Do you have any medical or surgical history?
No.
Alright. Do you take any medications?
I take some Advil occasionally.
How often is occasionally?
I think every other day.
Every other day? Okay, so that's pretty frequent. What are you taking that for?
Headaches.
So you get headaches pretty much every other day?
Yes.
Have you seen a doctor for that, or is that why you're coming in today?
I've seen a doctor for it.
Okay, so you're working with a physician. Are you taking any over-the-counter supplements that I should know about?
No.
Okay. Do you smoke?
No.
Good. So I'm just going to look at your skin real quick. Just running my hands down your arms just to see, temperature is good, normal for your ethnicity, no wounds, everything feels good. Looking at your nails, cap refill is less than 2. There's no spooning, no thickening, no ridges, so that is normal, healthy nails. Alright, no swelling, lesions, bumps, or sores on your arms, so that's good. Skin turgor is normal. There's no tenting, which just means that you're nice and hydrated. Have you noticed any rash, lesions, bumps that you're concerned about?
No.
Perfect. So your skin on your upper is normal, warm, dry, smooth, intact. So I'm going to check your scalp real quick. There's no lesions. Your hair is distributed nicely. Normal cephalic. Have you had any head trauma?
I've had a couple concussions.
Okay, how long ago was that?
Like 15 years ago when I was playing sports.
Okay. There's no crusting, nothing abnormal on your scalp, so that's good. So now we're going to check your cranial nerves. First, I want you to lift up your eyebrows, close your eyes. So don't let me open your eyes. Perfect. Alright. Now open your eyes for me. Nice and normal there. There's no drooping, nothing like that. Show me your teeth. Now I need you to puff out your cheeks for me and then blow it out. And back to a smile. Perfect. So now face seems symmetric, so that's great. Just gonna look in your mouth real quick with a light. Can you say ah?
Ah.
Alright, uvula is nice and normal. There's no redness in the back of your throat. Have you had your tonsils out?
Yes.
Okay. Can you stick out your tongue for me one more time? I'm gonna push down your tongue and just check for a gag reflex, okay? Okay, and that is present. I did not see any obvious caries on your teeth. Gums look just fine. I'm going to ask you about your dental health. Have you been seeing a dentist regularly?
Yes.
Perfect. When was the last time you went?
Last week.
Great. How many times a day do you brush your teeth?
Once.
Once? Okay. Twice is usually recommended. Do you floss?
Yes.
Okay. Good. How often?
Every day.
Good. Have you had any bleeding on your gums?
No.
Alright. So I'm glad that you're already seeing a dentist. Back to your eyes real quick. Eyelashes, eyebrows all look symmetric. I'm just going to check your pupils real quick. Your sclera is looking nice and clear. No jaundice. Your pupils are normal. Pearly, which just means they're equal, round, and at rest they were 4 millimeters. So when the light is on them, now they're 2 millimeters, nice and constricted bilaterally, which is perfect. So we're going to check your peripheral vision real quick. I need you to cover one eye, whichever one you choose. And I'm going to have the stick over here. Can you see anything yet?
No. Yes.
Okay. Now I'm going to come on this side.
Yes.
You can see it there. Perfect. Now let's switch. And same thing.
Yes.
Right, now this side.
Yes.
Alright. Peripheral vision is normal. Cranial nerve 2 is what we were actually checking with that, and it was intact. Now we're going to follow this light. First in the center, now up, center, down, center. Great. Perfect. No issues with that. Everything is nice and symmetric. Now for your ears, I'm just palpating. No pain there?
No.
Any trouble with your ears? Any discharge?
No.
Good. They're intact and symmetric. No lesions or tenderness. Now for your nose. Any trouble breathing?
No.
Good. I'm going to cover up one nostril. Now the other. Perfect. So no stuffiness there. Do you have any tenderness, any discharge or nosebleeds?
No.
Perfect. Now for your neck. I'm just palpating for any tenderness, any lumps, lesions, your lymph nodes all feel normal. No pain there. Now I'm going to check your carotid pulse, one at a time. If you do two, we can actually make you pass out. Don't want that. Your pulse feels nice and strong. And I did feel your trachea. That's midline. There's no deviation to that, so that's good. I need you to shrug your shoulders up. Now I'm going to push down, and you're resisting them, so that's normal. Can you turn your head left to right? Perfect. And then up and down. All right. Now I'm going to get you to do that one more time and resist. Perfect. Now this way. Great. And then chin to chest. And back up. Great. So everything is equal, full strength in your neck. Alright, so now I just need to palpate and listen to your lungs. I'm going to start in the back. If I can just have you turn a little bit this way. Your spine also appears straight. Your thorax is symmetric. I'm going to have you breathe real quick, and what I'm doing is just to make sure that your breath is nice. Your lungs are expanding nice and symmetrically with my hands. Perfect. Now I'm just going to listen here. And I'm listening to all of the lobes of your lung to make sure things are nice and clear. And we do have clear breath sounds on all fields. Now I'm pushing down to your 12th rib. Do you have any tenderness there?
No.
Perfect. So now I'm going to have you say 99 out loud as I feel the different sections of your
99, 99, 99, 99.
Perfect. So that checks for resonance, and that's normal. No tenderness, masses, lumps, or lesions on your back. Now I'm just percussing, just tapping on the finger, making sure everything is normal there. Great. So I'm going to do the same thing in the front. Listening again. Deep breath. Great. All of that sounds just fine. So we're going to do that 99 one more time. Okay?
99, 99, 99.
Alright. Now I'm going to listen to your heart. I'm going to start by finding your apical pulse. That's usually about the 5th rib down. Just listen to your heart. So I'm comparing your apical pulse to your radial pulse to make sure that everything is nice and normal. And we should always listen to the apical pulse for a whole minute. Listening for any murmurs. I do not hear any. A normal S1, S2. Listen to your different heart sounds. Your rhythm is nice and regular. Now I'm going to have you put your arms straight out. And you spread your fingers. And you squeeze my hands nice and tight. And then can you kind of push me away? Great. Nice and strong. I'm going to feel your brachial artery on both. And you did have full range of motion, good strength in both arms and hands. Brachial artery is also normal. Now I'm going to have you lay down for me. Face up, please. And I'm checking for any jugular vein distension. I do not see any, which is good. I'm going to pull up your shirt real quick just to look at your abdomen. It does appear rounded. I see a large scar midline. Was that from a surgical procedure?
Yes.
Okay. So other than the scar, rounded abdomen, there's nothing on inspection that's abnormal. I'm palpating. Is there any pain?
No.
Okay. Any deep pain when I palpate deeper?
No.
There's no organomegaly. No pain. I'm just going to listen to your belly real quick. And I'm just making sure that bowel sounds are normal, digestion is happening, and they are normal active. Perfect. So now just percussion. Same thing like I did on your back. Normal. No issue there. Now down to your lower extremities, just looking, there's good hair distribution. I don't see any wounds. I'm going to feel your inguinal pulse, also your femoral pulse. That's normal. Feeling your popliteal. Normal. Dorsalis pedis. It's normal as well. Alright. And that was your posterior tibial that I just felt. Can you lift up a knee, try to get it to your chest? Perfect. Now you can put that back down. Same with this one. Good. I'm going to palpate your hips. No pain there?
No.
Perfect. So he has good extension, good strength in both legs. Now I need you to push down your feet like you're pushing a gas pedal. Pull them back up. Perfect. So plantar and dorsiflexion are normal. Now I'm going to check some of your reflexes. So I'm going to put my finger kind of in your elbow and hit your bicep. Do you normally have slowed reflexes?
Yeah.
Okay, because that one's definitely a little bit slower. I'm going to hold the back of your elbow and hit the tricep. And there's very little reflex there too.
Slow to no reflexes.
Okay. Well, good to know that that's normal for you. So I'm going to have your forearm up. And what I'm seeing is just that your wrist is coming up. That is a brachioradialis reflex. And this one's a little bit slower on this side. But we said that that's normal for you. I'm going to have you sit for me real quick. I'm going to check for that patellar reflex. Normally we would have a neuro hammer for this, but we'll see what we can do with 2 fingers. Not a whole lot. Then for your Achilles, not a whole lot back there. But that's normal for you and the doctor is aware of it. Now I'm going to have you stand up and close your eyes for about 30 seconds. There's no swaying noted. You're standing nice and tall. Okay, go ahead and touch your toes. Perfect. No issues there. I'm just palpating your back, no pain here.
No.
Cool. Can you twist from side to side? Crack. Alright, so no pain or problems with your spine. You have full range of motion. Now I just need you to bend your knees real quick. No pain there?
No.
Great. So now I'm going to have you just walk across the room normally. And on your way back, if you can walk on your tippy toes. Great. Now walk on your heels that way. Perfect. And come on back so you have normal coordination in all aspects. So that is the end of our head to toe assessment. Thank you for your time.
Thank you.